Let's talk about the overview of pathology and what are the essence that you need as you're studying and going through the syllabi notes as well as on your own, because each person as a student learner integrates and looks across the information in different ways. So we have to get a basis for the first 9 chapters as the foundation. It's concrete, it may not look sexy, but during an exam it will find its relevance to you. It'll be your blanket to wrap yourself around in comfort, no matter what the question is. So one thing they'd like to ask on the USMLE is the cause or the etiology. This becomes critical because as a physician or taking an exam, you want to understand how you can prevent the disease if you know, obviously, what the cause is. If you know that many diseases are related to cigarette smoking, the obvious way to prevent it is to essentially stop smoking. And we'll talk about that later when we get to the lifestyle pathology. Obviously, the etiology can have a genetic basis for it. You can, at the time of birth, or you can acquire new genetic alterations after birth. And so that becomes important, like you get from cigarette smoking. When we talk about acquired etiology, we think of a disease like AIDS or acquired immune deficiencies syndrome, and where basically you acquire the disease because of the, in this case, a virus that now causes damage to the immunologic system that allows increased incidence of opportunistic infections as well as neoplasias. And we'll talk about this in more depth when we get to the immunopathology section later on. What they really emphasize in the USMLE, and which is the appropriate way that the foundation of medicine is trying to be looked at, and that is the pathogenesis. So how do we think of the pathogenesis? It's like learning a story, and that's how you should study for the USMLE. Learn these as stories, as not as basically a memorization, because they'll get you on that. They know if they gave you a telephone book, you'd memorize it if you had to, but they wanted to know how to use the telephone book, in this case, understanding the pathogenesis. So it's a sequence of events, because one of the most important variables as clinicians, as well as they test you on the USMLE, is the variable of time. And how do they test you on the USMLE? The first thing they give you is the age of the patient. That sets the tone. How many days, weeks, months, years has the patient had that process? When does it occur during the day? What activities related to it? This is all a reflection to the pathogenesis, the sequence. You think of like reading a book, going to a play, studying for the USMLE. Step 1 or step 2 or step 3 is that there's a beginning, middle, and end. And these clinical vignettes are going to give you a sense of where you are in that process. And they're going to ask you, what do you expect to see at that time? And that's the critical thing you should always think of. And then it's much easier for the learner, yourself, to really put it in perspective that makes sense. So the pathogenesis is the critical part that one needs to look at. And we'll see this as we go through and think of these as stories, because we can't memorize lists, and you should never memorize a list for the USMLE, no matter what the discipline is, because it will not be asked. We'll get to the how to approach lists in a little while. So again, the pathogenesis, the temporal sequence of events that's critical. It starts at the molecular level, that alters the biochemistry of the cell or tissue, and then is be reflected in the tissue, and then that will relate it back to the signs and symptoms that's important in understanding the disease process. As a prelude to this, you have to think of pathology is basically you have a tissue, you have a cell, you can see it under the microscope, you can see with your eyes, you can touch it, and so we look at the morphologic changes. But that takes time. That's another important thing. That's a reflection of the pathogenesis, is always relating the morphologic changes back to the pathogenesis. It's a reflection of it. And obviously, we start at various levels. We can see it with our eyes. Therefore, we can basically see it as gross, and we'll talk about the changes in a moment. What are the characteristics or the description that we'll describe in the USMLE? And then the microscopic changes. And that's going to be, they don't show a lot of slides on the USMLE. And how many, because always students want to know how many as a comfort, maybe anywhere between 10 to 20 during anyone's exam, or less than that. But it's not important that you have to memorize these images, is that when you do face that image and you see an exam, we'll show you a technique in which how to approach it. It's going to be fairly painless, because you don't want to become the pathology during the exam or while studying for the USMLE. Then obviously we have to relate it back to the clinical significance because they're giving you obviously a clinical vignette and you have to relate it back to the signs and symptoms. So this is an integrated approach. When you're studying for the USMLE, you must integrate across disciplines and across the story and think of what's happening at the molecular level, at the cellular level, within the cell and the different organelles, and then obviously the tissue that's composed of these cells, and then the organs, and related to other organs, because once one organ is affected, what is going to be the consequences or complications? The sequelae of that disease process that becomes critical, and that's what they want you to problem solve when you're taking the USMLE. So again, it's the signs and symptoms, and in relating it back to the pathogenesis of the disease process. And then obviously a consequence of any disease process, what are you trying to minimize as a physician, or trying to minimize the damage that one sees during the USMLE is basically the complications. We'll talk about that. And then obviously it's going to have an impact on the pathogenesis, depending on when the disease occurs as an infant versus a 92-year-old.